What is being kept in a small space because of the new coronavirus like? Passengers on a vacation trip in the western Pacific Ocean know very well. They are on the Diamond Princess, a huge cruise ship that is quarantined in the Japanese port of Yokohama. More than 200 passengers on the ship have been infected with the new coronavirus, COVID-19. Health officials have reacted by keeping about 3,500 passengers on the ship. They are waiting until existing cases can be treated and other passengers are cleared of the disease. The number of cases from the ship is the largest group of infections in the world outside of China. The Associated Press spoke with passengers and looked at their communications on social media.
Even during the quarantine, Cheryl and Paul Molesky appeared to still be on vacation. The two Americans from Syracuse, New York, can be seen in YouTube videos relaxing, often in bathrobes. They appear to be enjoying themselves, looking at the ocean and snow-covered Mount Fuji in the distance. We try to have an upbeat presentation. We're not hurt, we're not in pain, we're actually just enjoying ourselves, said the 78-year-old Paul Molesky. 59-year-old Cheryl Molesky spends several hours each day answering emails and texts and preparing their YouTube videos. She said they are concerned when a new group of cases is announced, but she added there was little they could do. We decided to make the most of every day.
One Japanese man in his 30s, who did not want to give his name, said he spends his days mostly taking pictures of each meal. He then posts them anonymously on Twitter. "All I can do is to wait and tweet," he said. The ship has restaurants and many forms of entertainment, but they are mostly closed. Passengers now mostly must stay in their rooms. Less costly rooms on the ship are not much wider than a double bed. Pictures posted on the ship's website show that there is space only for a desk chair. The least costly rooms do not have windows. The larger rooms are about 20 square meters or less. People on the ship must clean their own rooms and clothes. Contact with the crew has been limited since the first 10 cases were confirmed in early February. For many, the days now center on food service. One crew member, wearing a mask and gloves, hands out the plates. Another provides other things needed for the meal, while another notes names and room numbers. The boat has added more movies and TV channels to try to help with the boredom. People without balconies are permitted to walk outside for about an hour each day. They must keep 2 meters apart, however, to avoid spreading the virus. Passengers talk and wave to each other from their balconies. For the Japanese man on the ship, the food is one of the biggest problems. "I miss Japanese food," he said.
A recent video posted on Twitter shows a group of men wearing masks and what appears to be the clothing of kitchen workers. One man, identified as Binay Kumar Sarkar, says, "We are scared. We appeal to the Indian government and the United Nations to help us." Some of the crew members who got infected with the virus are restaurant, bar, or housekeeping workers. They most likely had contact with passengers until those services were closed. Until the quarantine started, everything was business as usual, and everyone was freely moving around, said Kazuho Taguchi. He is Director of Global Health Cooperation at Japan's Health Ministry. Crew members still share rooms, as the number of cabins for them is limited, Taguchi said. But one crew member said he had been isolated in his room 2 days after he reported a pain in his throat. Everyone on the ship is scared. Many people are falling sick, and now the crew's getting sick too, he said. While he waits for test results, he has been reading all the news and communicating with friends and family. Officials in Japan say isolating people on the ship is one way to prevent the disease's spread. Other experts argue the measure could create more infection. Reiji Goto is a doctor at Diayukai General Hospital in Ichinomiya. He told TBS television, "More and more people are getting infected while they are trapped on the ship, which is not good for disease prevention." Tara Smith is a professor who studies infectious diseases at Kent State University's College of Public Health in the United States. She said a hospital, not a ship, is the best place to keep people quarantined. Smith added that she has concerns about new infections and the passengers' mental health.
For some, however, the fear might be worse than the virus. Many people, for example, do not show strong signs of infection with the COVID-19 virus. On Thursday, an Australian mother and daughter spoke to Australia's 9 network television from a Japanese hospital. The two said officials took them off the ship after a test showed that the daughter, Bianca da Silva, was infected with the new coronavirus. She said health workers put her in a wheelchair covered with a protective material. Bianca and her mother, Suzanne, said they were both briefly sick, but feel fine now. "Honestly, it just felt like your everyday cold," Bianca said. "I had a bit of a headache before and just a slight fever, but that's about it, honestly," she added. I'm Kelly Jean Kelly.
And I'm Mario Ritter, Jr.
Thousands of African students in China are watching as the coronavirus continues to spread. They are hoping that their governments will get them out of China soon. Solomon Yohannes of Ethiopia is a third-year engineering student at Wuchang Technology University in Wuhan, the center of the outbreak. As he sat in a room at the school, he said almost all of Wuchang's 15,000 students have left, but about 200 foreigners, most of them from Africa, remain. "We are counting on the next 2 to 3 days for some solution," Johannes told VOA's Afan Oromo service. Until then, he and others will not leave their buildings. He explained that when going out, people have to wear masks and other protective devices to guard against infection. Another student at Wuchang called on the Ethiopian government to take action. We want the government to take us out of the country, as every other government is doing, he told VOA's Amharic service. The student noted that the United States and India took many of their citizens out of China. We also want to tell the government to at least take us out of the city where the crisis is right now, he added. There are about 61,000 Africans studying in China. Many now face food shortages, isolation, and questions about the future. Last week, tests showed that a 21-year-old student from Cameroon had the coronavirus. He was studying in Jingzhou, a city about 230 kilometers from Wuhan. He is the first African student reported to be infected with the virus. Hermes Kundu is from the Central African Republic. He is a third-year engineering student at Nanking University, about 530 kilometers east of Wuhan. He said students there are careful about being with other people. We buy food online, you see, and we cook inside our rooms because it is not easy to get to the common kitchen over there, as many people are there cooking, Kundu told VOA's French to Africa service. And you never know, you could be in contact there with a student already infected with the coronavirus. So we stay in our rooms. Anthony Waigwa of Kenya is at the University of Chinese Academy of Sciences in Wuhan. He is working toward a Doctor of Philosophy, the highest degree offered at the university. Waigwa said that he and other students have been offered masks, free Wi-Fi, and a telephone hotline for information about the virus. The situation is tense. We're just afraid of contracting the disease, Waigwa told VOA's Swahili service. He said the students are trying to stay safe by not leaving the school's grounds. The Ethiopian ambassador to China, Teshome Toga Shanaka, said his country's embassy is closely watching the situation. He added there are about 100 Ethiopian students in Wuhan City and about 300 in Hubei province. He said the embassy is in contact with student groups, but said both the government of China and the World Health Organization have advised against fleeing the area right now. This is a very serious matter, the ambassador told VOA's Amharic service. We are very much concerned, of course, about the situation. But we also have confidence in the prevention and control measures the government of China is taking. He added that several different agencies need to work together to organize student evacuations. He said many African embassies are in touch with one another and ready to act if needed. I'm Jill Robbins. The Bill and Melinda Gates Foundation said this week it will provide up to $100 million to support action against the 2019 novel coronavirus. It says the money will help strengthen efforts to test people for the virus, separate healthy individuals from the sick, and find treatment for them. The donation includes the $10 million the Gates Foundation offered in late January. Mark Suzman is Chief Executive Officer of the Gates Foundation. He said that national governments, private industry, and aid groups must join together to help protect people who are most likely to get sick. The donation will help speed development of the tools to bring this epidemic under control, he said. He added, "This response should be guided by science, not fear, and it should build on the steps that the World Health Organization has taken to date." The Gates Foundation is giving money and working with other donors to help the World Health Organization, WHO, Chinese medical workers, and others worldwide. When WHO called the outbreak a public health emergency of international concern, it noted the need for an organized international effort to fight the virus. China's government has also declared a national public health emergency and launched a nationwide effort to contain the virus and treat those who are sick. The foundation promised $20 million right away to hurry the process of identifying those who are sick, keeping them separate, and helping them get better. The goal is to stop the disease from spreading to more people and places. Some of the money is going to WHO and the United States Centers for Disease Control and Prevention. Money is also going to public health officials in China and other countries with coronavirus patients. The gift is aimed at helping them pay the startup cost of medical workers and supplies, while governments and international agencies are paying for ongoing operations. Recent epidemics, such as the H1N1 influenza pandemic of 2009, have had a big effect on people living in extreme poverty. Most of those people live in African countries south of the Sahara Desert or parts of South Asia. They do not have good basic health care, so they have higher than average health risks. Another $20 million is going to public health officials in these areas to improve their emergency operations and to treat confirmed cases. One partner is the African Field Epidemiology Network, a nonprofit service that currently operates in more than 30 African countries. Of the total donation, $60 million will go to speed the process of making vaccines to protect against the novel coronavirus. It will also support efforts to learn the best way to treat and identify those who are sick. If the outbreak continues for several months or more, public health officials will need to have safe and effective vaccines and medicines. One organization working on developing vaccines is the Coalition for Epidemic Preparedness Innovations. It has called on scientists to propose research on dealing with the coronavirus. They are already working with the Chinese public and private sector researchers, trying to find ways to stop the spread of the virus. I'm Jill Robbins.